Now, if we think about Kristen, she told us that she had symptoms every day when she exercised and sometimes would wake up 1 to 2 times per week coughing. If we put these two symptoms that she describes in the categorization of asthma, that would tell us that she has moderate persistent asthma. Moderate persistent asthma is one of the more severe types of asthma, and it is recommended that a person takes daily steroids, daily inhaled steroids, and an as-needed rescue inhaler. Now, Kristen was on these 2 medications before she had this emergency hospitalization. So what happened? Well, what the team was talking about this morning on rounds was that probably she was exposed to some kind of an environmental trigger, whether it was cigarette smoke or maybe she got a little cold, that probably made the inflammation and the bronchospasm get worse in her lungs. The trick is this kind of happened gradually, and Kristen wasn't really aware of it. So what this makes us wonder is, how can we treat Kristen's asthma symptoms better? So that's where this thing comes in. This is the peak flow meter. The idea that we had on rounds this morning was that we could use this peak flow meter to teach Kristen how to be more in touch with her symptoms. What she would do is she would take a great big deep breath and blow very hard and fast in through this mouthpiece right here. And this needle will go up according to how well she's breathing. So when her asthma symptoms are not present, the needle should go up higher. When she's having an asthma attack or her asthma symptoms start to get worse, the needle doesn't go up as far. So what I'm here in the library to do is to try to look up whether or not there's evidence in the literature to support the idea that teaching Kristen how to use this peak flow meter is actually going to help her manage her asthma better. So we framed our evidence-based medicine question as such. In a teenager with asthma, can an action plan that employs a peak flow meter, rather than a symptom-based action plan, actually decrease hospitalizations and ER visits? So what I'm going to do is I'm going to go to PubMed, to the clinical inquiry section, and search the terms peak flow action plan, asthma, and hospitalization, and see if I can find any literature that will tell us the answer to our question.